Well, okay, we're almost at 5 after, so I'll get started with the regular meeting, and then we can hear how things have been going at WINCO, probably one of the places seeing the most foot traffic in Eureka at the moment. So this is very well timed. I'm sure. I drove by and saw the lines. So just a little Zoom meeting maintenance. If any background noise gets a little crazy, I might try and mute people, but feel free to use the chat box. Hopefully none of our dogs go crazy. It's been an issue with my puppy. But we're gonna hope things go well. So I'll start us off. Now, normally we would have all of us in one room saying the Pledge of Allegiance, but since we don't have that, I have this American flag we can all look at and still say it in our own area to pay tribute. So let's all join in. I pledge allegiance to the flag of the United States of America.
Flag of the United States of America. And to the republic for which it stands, one nation, under God,
indivisible, with liberty and justice for all.
Justice.
Okay, well, we learned with the
make
lag.
a suggestion. Next week, do the Star Spangled Banner, America the Beautiful, or something like that.
We'll do that. Not being in one room, it makes for quite a different experience. All right. One thing I also didn't think about was having someone to do an inspirational moment, but I do have an update. Member Carlton Nielsen underwent liver transplant surgery on Friday night. So that is good news. I haven't heard any updates since then, so I hope all is going well, but the fact that he got the liver transplant bodes very well. So everyone, please keep Carlton in your thoughts and thoughts of his family. Obviously, we can't go see him for various reasons, but maybe a nice note if you want to send him an email or text just of encouragement as he's going through the healing process from that. So, as you, I'm sure, all aware, events of almost all form are being canceled or postponed. So I wanted to go through some that affect our club. The Humboldt County Science Fair, which we are normally a large sponsor of, is not happening this year. So yes, which that is a bummer. For the students primarily. So I don't know what plans they have in place. I think they might still be awarding students for their projects, but they're not going to have the big event or be sending students down to a big state competition. So that is a bummer, but we'll stay connected with them and see if there's another way we might be able to help. Rotary-wise, our district training assembly has been canceled or postponed. More to be determined on that later on. We had a 1923 committee coming up this week, which has been canceled. We were planning a Rotary blood drive on April 8th. I'll talk a little bit more on that in a bit. We're canceling the actual one-day drive where we're trying to get everyone in one room together to give blood, because that didn't seem to be a good practice of social distancing. But blood bank is very much still in need of donations, so I'll talk a little bit more about that later on. And also big news, our Rotary District Conference, which was going to be up here in Fortuna, has been canceled or postponed, and the International Conference in Honolulu is canceled. So unfortunate events, but given the times we're in, not all that surprising. We have not fully canceled our big fundraising event that is scheduled for June 5th. We are going to cautiously watch how things progress and update you later on if that too needs to be canceled or postponed. Given all of that, there are still ways you can help the community. We do have some good relationships with a lot of the nonprofits that are working to help in this time. Obviously, me working at Food for People, I know of our needs. Food for People is still working throughout this crisis. So volunteers are one of the biggest needs right now. Obviously, when asking for volunteers, we're asking for those who haven't specifically been asked to self-isolate. So that's people who don't have chronic medical conditions or compromised immune systems, under age 65 plus, unfortunately, and anyone who's been exposed to a sick individual in the last 2 weeks are all asked to stay home. But outside of that, there are things you can do. One of them is volunteer at Food for People. Packing bags is a big one right now. Area 1 Agency on Aging called to let me know that they are very much in need of volunteer drivers. So specifically getting groceries for seniors, which is one of the big concerns right now. And the next big one is blood drives. So I talked with Kate recently, and even before coronavirus started impacting anyone and everyone, the blood bank was already seeing a decrease in blood donations because of a very severe flu season. And now with the coronavirus, blood is needed more than ever. And they're seeing far few people coming out because of self-isolation and shelter in place. You are still allowed to go help out these nonprofits because they're considered an essential service. So blood donations are very much encouraged if you are able, and make sure you're feeling well before you go out. And one thing that Greg Gardner suggested we do in honor of Carlton is a blood drive. He has spent several weeks in several hospitals and has required several blood transfusions. So he himself has been using blood donated by good meaning individuals, and we can do our part. So over the next few months, if you are willing and able, go to the the Northern California Blood Bank and give blood in honor of Carlton. So we can make sure that all of those in need of a blood transfusion can have it when they need it. It's going to be more crucial now than ever. Okay, so I'm going to do a quick thing. Instead of our classic Rotary Minute, I am going to try and share a video just for today, and we will see how it goes.
Getting pretty gutsy there.
I know, and we all know my my track record with videos in Rotary meetings, so we'll see how this goes. But thinking about coronavirus pandemic, what it means for our world, and also the role Rotary has played in spearheading vaccinations across the country, I thought we would try this video. So hopefully audio plays for everyone. If not, let me know.
We've forgotten how afraid we were. In 1952, the threat was real. Parents were advised to keep children away from crowds. Pools closed, and movie theaters went dark. Hysteria grew. People were quarantined. It was the worst polio outbreak the United States had ever seen. But it's not ancient history. It's still circulating. As recently as 1988, the World Health Organization estimates that the world saw more than 350,000 new polio cases that year alone. That's nearly 1,000 new cases per day. But through the largest global health initiative in history, we've gone from 350,000 cases annually to just 74 in all of 2015. That's a staggering 99.9% reduction. But we can't quit now. If we don't stop circulation of the virus, we risk reinfection and outbreaks. That's why getting to zero matters. We're not saying it'll be easy. Vaccination in these countries is complex and expensive. In our ultra-connected world, the disease is never more than a plane ride away. Within 10 years, failure to eradicate polio from these last remaining strongholds could result in as many as 200,000 new cases every year. We've immunized 2.5 billion children in the world's largest, most sophisticated global health initiative. Our commitment to eradication matters now more than ever. We are on the cusp of making history.
All right, did that go okay for everyone? All right. Now let's see if I can get back to our Rotary presentation.
Can anybody hear me?
Yes,
You can?
Yes.
we can hear you,
good.
Bruce. Okay,
Good.
we're just moving on through our program.
Hello. Be healthy, be happy.
Okay, so I don't think I saw him join us, but our Rotarian of the month is Michael Cunningham. So I wanted to send some virtual recognition to Michael. He was chosen this month for his dedication to Rotary and also the immense amount of work and guidance he has put in the last few months. For any of those who might not remember, we had an issue with check fraud on one of our accounts. So Mike got thrown into the deep end of being a treasurer for Rotary Club and everything that that means. And he's been very on top of it, and it's taken a lot of his time, but he's been very thoughtful and done some amazing stuff for our club. So next time we do see Michael, we want to give him a big thank you and a big congratulations for being an amazing Rotarian. All right. Some recognitions, member birthdays. So Mindy, Alyssa, and Dick all celebrate birthdays this month. I don't know, Mindy, did you get to do anything fun for your birthday?
My daughter got the stomach flu, so no.
Oh.
Happy birthday to me.
All right.
I can think of worse things. Stomach flu's okay compared to everything else.
Yes. Okay. Member anniversaries. Arnie King celebrated an anniversary earlier this month, and Linda Wise and John Winsler are both celebrating anniversaries this month as well. So definitely less stuff going around able to recognize because everyone is sheltering in place. But I did want to call out some people who've, you know, taken the time to do some good things. Arnie King and his wife, Jessica, actually took our exchange student, Sandy, who's from Paraguay, out to the snow before shelter in place was enacted. I don't know if any of you remember, but seeing the snow was one of her bucket list items for her year on exchange. So thank you, Arnie. That's huge, especially now that she is going to be able to go out a lot less and experience a lot less of what our community has to offer. So really excited to see that she got to do that before she was in place for a prolonged period of time. So I would try and play the video, but me and my husband took our puppy out to the beach for the first time. He loved the beach. He was not so sure about the waves. He was a little terrified. These photos.
Who is that? Is that your husband or your dog?
Oh, hello. Thanks, Bruce. Now,
Sorry,
these
that
photos,
was a bad joke.
I'll take it today. We need some good humor today. These photos, Tom Schallert shared with me. This is what him and his wife Tessa have been getting up to in their shelter in place. Some puzzles, some gorgeous sunsets, and a little bit of wine. Here is a fun one. Member Clark Swan arranged for local musician Michael David, I don't know if any of you know him, to do a virtual concert for all the kids in her friend group. So the kids could listen to some Disney music while in isolation. So a neat and creative way to still have fun during shelter in place. And Bruce Rupp, I don't think is here today, but he shared that he went out and bought a gift certificate to Ultimate Yogurt as a way to support one of his favorite local businesses through this tough time. And that is something I think each of us can do if we can make it out to our favorite restaurant. A lot of them are still doing takeout services, but now is a really good time to help support our business community because everyone is feeling it and we don't know when things are going to get back to normal. So good job, Bruce. Okay. I think that was it. Does anyone have anything else they want to share about their time in isolation? Okay, not seeing any raised hands. So we are going to get right on to our program so he can get back to work because he is in a very busy time. Do you want to tell us a little bit about what life has been like? Oh, let me make sure you're unmuted.
Are we good?
Yeah, I think we are good.
Yeah, perfect. So what's life been like? Ever evolving, I guess, would be the greatest phrase for that. As of last week, obviously, for us, that was really the peak of the panic buying, if you will. And when you're looking at, not only our store, but the size of the company itself responding to, let's say, a 174% increase in business, there's a lot of pieces that have to fall in place to be able to manage that. And fortunately for us, we work for an amazing company that can do that. So we saw stores such as ourselves that would have an average delivery night of, let's say, 5 truckloads of groceries inflate to 10 to 13. And when you look at that on the grand scheme of things for our entire company, that's approximately 114 extra deliveries that were sitting in the warehouse waiting. So we all had to adapt quickly. And locally for us, thankfully, the team that I have here was able to respond just in an incredible fashion, having dealt with some of the challenges in Humboldt previously with the power outages and the panic buying, if you will, at that time. Great coordination from the team, being able to work at extended hours. Some of my employees were working 7 days a week, upwards of 14 hours a day, just trying to be ready for anything that we could and supporting the community. And as things have evolved day by day, we've put different practices in place to follow the CDC guidelines for proper spacing between customers and in-stock conditions with some limitations. But the thing that's been amazing is the public's response to what it is that we do has always been well received. So we started limiting the number of customers in store so that we're no line in the register, so people weren't next to each other. And for any of you that have shopped here near the first of the month or those first 2 weeks of the month, know what this store can be like, where you've got 300 to 400 people inside the store, and gosh, it just feels like every one of them's at the register at the same time. But we stopped that, so there's maybe 5 people on the aisle. There's nobody in line in a register at any given time. But everything that we've put in place, we've just gotten an amazing response from the public. So it's kind of what we've lived with so far, and that is trying to make sure that we're well stocked to the best of our ability and meeting everybody's needs, and then also taking that extra time now that we've got some temporary help hired, is literally just wiping down every surface that somebody touches all day long. So it's been a fun ride. Sometimes we'd like to get off this ride, but I think the team has responded just incredibly, and the response from the company meeting our needs has been fantastic. And we finally got caught up yesterday to where we're receiving all of our deliveries on a regular basis right now.
That's awesome. Would you say you're fully stocked now?
Outside of the things that the rest of the United States is out of, which is hand sanitizer and any cleaning products, what we're finding now is a lot of the manufacturers are now continuing to supply the hospitals and the medical industry instead of, the grocery stores, which we fully support. We're getting in things on a limited basis in regard to like Clorox cleaning wipes, if you will. Paper products I'm getting in every day. I just don't necessarily get the quantities that I would like. But in the mornings when I get here and walk the floor, we've had everything available except for hand sanitizer.
Wow, that's awesome. How, I guess I'll ask some questions, and then if any other members have questions.
Absolutely.
How are your staff taking it? I know it must be very stressful to not only be dealing with the volume of people, but being kind of on the front lines, not being able to shelter in place.
You know what? The staff itself, I've had zero personnel that has said that they feel uncomfortable or that they feel that they're more at risk than before. With the cleaning that we're doing, with the lines on the floor separating customers 6 feet apart, We're operating every other register. Just those different things that were put in place for not only the public safety, but for our own has been fantastic. Providing them the tools that they need to make sure that they're maintaining their own personal sanitation as well as their workstation has been fantastic. And I have employees calling in every day saying, okay, I'm off today. Did you need me to come in? So definitely no challenges in regard to employment now. In the beginning, we had a shortage because when you see 100% increase in sales, I just simply couldn't staff what it is that we needed. But now that things have slowed down a little bit and we brought on some temporary workers, we're able to meet those needs as well. But I couldn't have asked for a better team to respond in this situation. And as bad as it is, all the previous power outages and panic buying that we've had before has helped build them to respond to this just in an amazing fashion.
That's wonderful. I see Jerry has his hand up. Jerry, do you have a question?
Well, just a comment. My wife and I drove by yesterday, and it looked like you guys really had things well in hand. I didn't see lines out in front of the store. It looked like things were going much, much better.
Yeah. And I'll say this, it was going to be, I guess what we were kind of waiting for, if you will, was the peak in panic purchasing and the number of available dollars that the public had to spend on extra food. There was going to be a breaking point. It looked like that breaking point happened on Friday, to where people had exhausted their extra funds, if you will. So our sales have declined, which was kind of a happy pause for us, to where we're back to what we consider our normal everyday sales. So that, along with all the practices we put in place, has really helped calm things down in the public, you will. Yes, line out times, no wait at all, which is fantastic. But even in the morning when I get here at 7 o'clock after we've been closed and we're just opening the doors, the public has been fantastic in recognizing, the 6 feet space outside in front of the store, recognizing, the need to self-police, if you will. It's been fantastic.
Great. Brad, it looks like you have a question. Let me unmute you.
Oh, I've got mute control here. So
Oh.
My question is for populations that are sheltered in place. Do you have special hours?
So right now we have a couple things going on. First and foremost, we have put in place emergency or any emergency response teams. So medical, fire, police, can all shop in the store from 4 a.m. to 7 a.m. So that way, based on whatever shifts they're working, they or their family can come in. We open the store to the general public at 7 a.m. And then on Tuesdays and Thursdays at 6 a.m., anybody over 60 or anybody that has any special needs can come in at that time, along with employees, and shop on Tuesdays and Thursdays.
All right. Do we have any other questions? Oh, Jason. Hold on, let me make sure you're unmuted.
I am
Go
muted
ahead.
myself. So I just wanted to thank you. I'm Director of Operations for City Ambulance Eureka and Care Medical Services for the offer to have first responders come in the morning. I'm hoping that some of our 58 EMTs and paramedics are taking advantage of that. The question, you brought something up. You said that also for their families. To this point, we were told that they needed to come in with their company ID and EMT or paramedic certification. Is there an opportunity for, because we do have this challenge where the shifts go until 8 o'clock in the morning.
Right.
So what other families to take their IDs in with them?
Absolutely. So anybody that comes up, the only thing that we ask is that there's some form of ID stating that you are part of the first responder. And that includes anybody in the medical industry as well. Hospitals, nurses, or I'm sorry, doctors, nurses, whoever. It's just some form of ID. We're not limiting anybody coming in at that time, if you will. We're just trying to ask that people self-police coming in. So far everybody's been fantastic as far as soon as they get to the door, they've got their IDs ready. But if a family member, and I've had this conversation with a few people that have called, if a family member comes in and they've got their spouse's or partner's business card and it shows who they are, we're fine with that. We're not, asking people to leave if they don't have the right form of identification.
That's great. Thank you very much for all that.
Absolutely. Absolutely. It's the least we can do.
All right. Any more questions? Okay. Well, I would like to say a big thank you for joining us. I know this has been a crazy time. So thank you so much for talking about what you and all the staff and team at WINCO have been doing over the last several weeks. It has been quite crazy. All right.
Absolutely. Absolutely.
Yay. All right. Wonderful. So that being said, that kind of brings us to the end of our meeting. I just want to say a big thank you. I know a lot of our members, Jason included, anyone who's in healthcare fields, first responders, food retailers, bankers, food bankers, blood bankers, all are still working and still working hard. So thank you for all of those who were able to join us today. And I will look forward to doing this again next week. We'll iron out some kinks and get things hopefully a little bit more back to normal. Maybe we'll try and brainstorm, see if there's a way to include a raffle component. Who knows? So if you have any feedback for me, please let me know. And thank you everyone for joining us today. And hi, Sandy. I see Sandy joined. Hey, Sandy. Okay. All right. Thanks, everyone. And hopefully I'll see you all next week.
Thank you.
Bye-bye.
Thank you, Carly.